Guys, so I'm going to cover an exercise that I use for developing several different things for a lot of my patients, especially those that have low back pain. So essentially this movement is performing kind of like a kettlebell clean from this half kneeling position and then coming up to standing and then coming back down. But what we're trying to work on is when we lift the bell, what we're doing is more of a hip hinge as opposed to bending. So I'm also trying to teach the person proper lifting mechanics, teaching them how to kind of move from the hip joint as opposed to bending and flexing the lumbar spine to lift an object. So the starting position is kind of like half kneeling, except we're going to open up the hips a little bit. So this is very similar to part of the Turkish get-up. So starting position, I'm going to use both hands and I'm basically going to pull the bell into the rack position. Another thing that this does is teach the person to learn to brace, to stiffen up the core in order to kind of absorb the shock of the weight. So I'm going to again hinge, clean it up into the rack position. So this also helps build good shoulder strength and conditioning. So we're holding in this position. Again, we want the wrist in a neutral or even slightly flexed position, forearm close to vertical, stiff core, and then we're going to come up to standing and then back into a reverse lunge, down, open up the hips, carefully bringing it down while we're hinging. So again, we're working on teaching good lifting mechanics, teaching an abdominal brace, and building up some good shoulder strength, as well as lower body strength and stabilization. Also, by having a unilateral or a one-sided load, what you're doing is you're improving the core strength, core stability, or what we call an anti-lateral flexion exercise. So lateral flexion is when you bend the spine this way. What we're doing with this movement is the weight and gravity wants to kind of bend or buckle the spine. We're not allowing it to. So what we're doing is building up a lot of strength and resiliency in the spine and the core musculature to basically avoid or prevent the spine from giving out or buckling or bending under load. So it creates a very good lateral core type thing. So from this position, again, good hip hinge mechanics, picking the bell up into the rack position, stiff core, come up to standing, back down, and then place it down and repeat. And I'll have my patients perform about 5 to 10 each side. Hinge. You do about 5 to 10 of those with a good amount of weight, and you'll feel like you're getting some really good conditioning in. Try it out.